A life and death crisis is playing out right now on public transit in the Twin Cities. Police, passengers, and light rail operators say the system is overwhelmed by drug use on trains and platforms, and it's only getting worse. Tonight, investigative reporter Eric Rasmussen shows us the video and incident reports, giving us a window into a problem that is threatening public health. Eric?
Kevin, just last month, operators wrote to the head of light rail asking for police escorts on and off trains at the Franklin platform because of crime, alcohol, and drugs. Over the last year, 5 investigates found repeated overdoses and other life-threatening situations are all part of a complex problem leaders have promised to address. First, though, a warning tonight that some of what you're about to see and hear is disturbing.
You have all this craziness going on. Fighting, loud music, smoking, drug use.
On the train.
On the corner with Crystal Beth.
And out in the open.
Like he ain't dead.
This is absolutely a public health crisis.
Union Depot, Lake Street, Franklin platforms.
We found widespread drug use on light rail lines connecting the Twin Cities.
One officer wrote, "A day does not go by that there aren't needles and other drug paraphernalia." Does that square with what you're hearing?
Oh, absolutely.
The accounts of Metro Transit Police, detailed in more than 100 incident reports and videos involving drugs and intoxication obtained by 5 investigates.
As it gets unsafe for the officers, it's also getting unsafe for the public.
Cameras recorded this woman in the red coat at the Lake Street platform in Minneapolis, smoking what police later identified as methamphetamine. Officers wrote her a ticket and let her go.
You too.
But many times the consequences are life-threatening. Drug overdoses made up nearly 20% of the cases we reviewed over an 18-month period, including this one at the Mall of America platform. Officers said medics administered the life-saving drug Narcan 3 times on a man who had passed out on the train.
We need safety for everybody.
Leaders and lawmakers pledged to improve safety in hearings at the Capitol. But that was more than a year ago, and over the last few months,
I'm scared every day.
we spoke to platform workers and train operators who tell us the problem has actually gotten worse.
You got the drugs, you got the needles, you got all of this, and it's like, why are you out here?
Needles everywhere. I've got pictures of piles of needles on the train.
Honey Darling is a longtime train operator and the light rail union rep at Metro Transit.
They're drinking, they're doing drugs.
She also testified at the Capitol 15 months ago.
Trains filled with vomit, urine, needles, trash. We miss those days compared to what's going on now. I mean, we have people lighting the train on fire.
Operators recently documented the aftermath in these photos. Darling says sitting down with us for this interview is a last resort.
You know, someone has to stand up for the public and the employees. I don't know what else to do. I don't know. I mean, I've tried safety reports, OSHA complaints, going to the Capitol twice. Nothing's helping.
Safety is something you continuously learn.
Charlie Zelli is chairman of the Metropolitan Council, which oversees Metro Transit. We asked him about safety concerns on light rail in January.
Why haven't more officers been hired to tackle this?
Well, we are hiring officers, and we're actually now put over several $1 million into additional overtime.
Zelli and some lawmakers also want more unarmed transit inspectors or ambassadors on the trains, a proposal that has yet to get off the ground or out of the legislature.
Drug use, unacceptable behavior is unacceptable. We have to have eyes and ears and personnel be a presence where people do not feel comfortable having that kind of behavior in our places.
Transit, you good, my man?
But even Metro Transit acknowledges it can't enforce its way out of the problem, which is why transit police are partnering with advocates.
There's a lot of scenes that you see that you're never going to forget it. It's hard.
Alexis Myers is an outreach worker with the nonprofit Radius Health.
I'm kind of worried that you're going to run out of options, right?
A familiar face offering help.
At least you don't have to walk.
On this day,
I got you, bro.
We followed her and an officer from Metro Transit PD's Homeless Action Team
All right.
at Union Depot in St. Paul.
And we'll get you a referral tonight down here, okay?
A place where sometimes people battling addiction are also unsheltered. It's a double-barreled problem Myers says has gotten worse in the last year.
A lot of the places where people received services during the pandemic shut down, and shelters had to drop to half capacity, and treatment centers had to drop to half capacity.
You know, a lot of homeless people are trapped in addiction, I think.
Now 9 months sober, Cody Reeves says he was one of those people who often ended up on the train.
We're all human, we're all people, and we have needs. You know, being on drugs, not having anywhere to go. Like you'd kind of find refuge there, you know.
Advocates say many in crisis would rather be elsewhere.
Morning. How you doing today?
And at a time when public transit is hoping to finally fill more of these empty seats with paying customers.
Do you want to get on with your family? I sure don't, and I work there.
The cost of this public health crisis might never be greater.
Since recording her interview with us a few weeks ago, that train operator, Honey Darling, tells me conditions have gotten so bad she says she plans to leave Metro Transit next month. The agency could hear more of these kinds of concerns again soon. Met Council has been partnering with local nonprofits to hold virtual community forums on safety and policing. And Kevin, the next one is happening tomorrow night.
I'm shocked. I can't believe it. Something's got to happen.
These are shocking images and shocking stories we've been tracking, and people are certainly calling for action.
Okay, Eric, I'm sure you'll stay on top of it for us. Thank you.